Bon dia, benvinguts, benvinguts.
Good morning, welcome. Please take a seat and let's start our first session on the Time Use Week. But first of all,
International guest, please. It could be easy for us. Comencem aquesta nova edició de la Times Use Week aquesta setmana. Els horaris.
we are starting on this week, Time Use Week, which is an extremely important meeting to assess the huge impact time has on our lives and on society at large. Time poverty generates lack of satisfaction, inequality, productivity issues, and also sustainability issues. And it affects all of us. That is why, for years now, this issue has been worked on from different perspectives, not just from the political sphere. In this edition, we want to thank especially the work carried out by the local communities, ground roots organizations, and the field of research. We've all got right to time, and we have to move forward in the sense so that everyone has right to time. And that is the slogan for our week. And we all have to make a joint effort in order to achieve our goals. Today is going to be a very intense day for various reasons. We'll be talking about the Catalan Network for the Right to Time and the research carried out in Catalonia. We're also going to present guidelines to have a better use of time at local level. And we'll also be talking about the challenges of the 21st century. And even more, and probably the most important part, we will renew the Barcelona Declaration on Time Policies after 2 years of hard work. And that will take us to the opening session of our Time Use Week. But not everything will be happening within these walls here. That's really important to take into account. As for this edition, there will also be about 50 different events going on, debating about the use of time out on the streets in different places, and also pilot projects that are trying to make it a reality out of what we're talking about here, making more time available to everyone. And then, of course, we have an institutional program. But the Time Use Week is becoming more and more decentralized throughout Catalonia so that all our territory can provide ideas and carry out different initiatives and put into practice the use to the right to time. And everything that we talk about here hopefully will be able to be spread to the rest. So today, as I say, it's going to be an intense day. There's a lot of work, and that's why maybe now we should move on to the first thing that we have on our agenda for today. Thank you for all of you for being here so early for our first opening session. We'll be looking at the strategies so that time policies reach everybody. And I'll be giving the floor to Davide Malmusi, who's the Director of Health Services of the Barcelona City Hall.
Vale, buen día. Gracias. Gracias por la...
Thank you to the organization for inviting me and also for thinking that we could provide our input for the session today. We work in the field of health, and we'll try to give you examples of how the policies and the programs that we carry out have a benefit for time policies, and time policies are also health policies. So I have a presentation. Hopefully you'll be able to see it soon. I don't know if it's ready to be screened. Perfect. So we'll be looking at some examples of health policies as time policies. So you can see that some of the things that we do as within the field of health policies can also be seen as time policies. Just to give you a bit of background of the relationship between time and health and the impact time has on health, we have a whole series of studies, some of them carried out by Lucía Artascos, and many other studies have been cited by her. She's probably the person in public health that has most experience and the impact that time has on health. That's why I wanted to mention her. And then also, we know that there is a direct impact between long working days and health. There's an international study that shows that's about 750,000 annual deaths due to cardiovascular factors and other are due to very long working hours. This from an international perspective. In some places, this is very frequent. In our own context here, when we go beyond the 40-week working 40-hour working week, and we see that the health indicators are worse, less exercise, less hours of sleep. And then another factor is the difficulty of trying to find a work-life, family-life balance. And it has an impact on different indicators of mental and physical health. In our context, we found that there's also differences between men and women and the different social classes. So manual workers, if they're women, have worse health indicators if their family is larger. So it adds on to the care taking activities, and also the number of members in the family has a greater impact on their health. Poverty, those of us here see that the people who have to combine work at home and also work out of home, they have worse health situation when it comes to hours of sleep, mental health, and so on, and also cardiovascular health. So time, therefore, is something really important for us. We look at many different social aspects that have an impact on health, and time is a key one. So having said that, here we can see all the actions that we carry out in order to democratize the support and the care to caregivers. And then we have digital welfare that has to do with the use or excessive use of screens. And the third one, mental health in the workplace. I'll start off with the first one. Now, looking at our health status, and before going into the details, we have here a graph which is one of those that we're working on in order to help people who take care of others. Now, women who have a bad mental health status, they're classified according to the gender, women in blue, men in orange in this case, and whether or not they are taking care of others. And towards the right, you have people who live with somebody who needs to be taken care of, and they are the sole caretakers, so the main person in charge of that. So, and usually women, sometimes also men, and in this case they have worse mental health status than the people in the other groups that are not looking after others. But even if you're taking care of somebody, you're not live with you in your house, you have a worse mental health status than the rest. Well, there are many other indicators that show how taking care of others affects your health and mental well-being. There's an overload, and this is why the city of Barcelona, we carried out an initiative in order to democratizing caretaking for others. And we had 4 objectives: to promote the co-responsibility of different social agents, reducing social inequality when it comes to offering care for others, recognizing care as a core part of the socio-economic life in the city, and also trying to strengthen the resources and services offered by the city to people who have to take care of others. So you can look at this in our website under the heading The Caring City, and there you can see also the temporary balance of this action. We're now going to renew this instrument as part of the action of our government when it comes to looking after people who care for others. Now, you can see another thing that we work on, we coordinate, and for our international guests, so hopefully we will see many of you tomorrow in the meeting there with Barcelona Cuida. And also we have the caring card, which is Tarjeta Cuidadora. It is a kind of single window where we make a declaration of intentions. We help people who need to look after others to know what the city has to offer for them, the city hall, but also other parts of the administration and other organizations to somehow, before, instead of having the person knocking on 15 different doors, and that in itself will lead to a greater burden of time and a mental burden also, we try to focus all these different sources of support in one specific place. And we offer an information session. We are open from Monday to Friday and also Saturday morning. So some people who may not be able to come in different time slots, well, they can come on Saturday. So very often we offer information on Saturdays to people who cannot leave the home during the week because they're taking care of people. And so we have a specific session for caregivers who have high burden, women over 70 years of age. We phone them up periodically to see if there's anything they need. We also have community action, and we do this from different organizations. We're now working with several organizations, but we are trying to extend to more to suicide survivors and the right to die with dignity, and many other Alzheimer's cares and so on. Then we also, after opening this space, we started what we call our Tarjeta Cuidadora, our caring card, which is free. It's offered to caregivers. So a person who looks after others receives this card as a recognition, and we offer them information, resources, free activities, different services. And in the slide, you don't have so many details, but you do have a 24-hour hotline. There's also a chat, specific actions for people who work in the home, and also different places we work with. There's, for example, restaurant vouchers at the San Pau Hospital, and there is also different points in which we offer services at different pharmacies, chemists, and libraries, and so on. Well, we offer this to people who care for us. And you can see here the impact that we're having. Last year, we had over 13,000 people who went to Barcelona Cuida, either in person or with online consultations. And we have over 7,000 people who have the caring card. They participate in different activities. They have support, and there are different resources that are offered them that may be of use. Now, let's now move on to the second pillar of my talk, the use of screens. So this year we started a cross-cutting plan for the use of screens when it's problematic. We looked at a series of indicators. I think everybody realizes that this is an emerging public health issue, and so we have to look at how we use our time. On the left, you can see indicators for 11 to 12-year-old kids. Up to 75% have difficulties to stop using internet and to not connect after doing their homework. And over half of them have arguments with their family because of how much time they spend on internet. From 13 to 19 years, 3 out of 4 teenagers declare that they have no time limits on the use of a mobile or the time they use watching a screen. And 1 out of 4 girls said they've suffered bullying online. And of course, all this can lead to cognitive impact in the earlier stages, up to 6 years of age, and in the late ages. And excessive problematic use in teenagers is associated to obesity, an unhealthy diet, depression, and a drop in quality of life. Here you can see what we're doing. These are our actions of Again 24 to 2027. We're working with 36 organizations in different entities. So it's not solely a City Hall initiative. We work with many other grassroots organizations. We have 3 lines of intervention for the critical use and healthy use of public technologies, the health public perspective, and then we have the alternative actions that can be carried out for entertainment. You can see these are all time use policies. For example, these healthy programs and alternative programs, sports, other ways of using time so that children and teenagers can use, and making space for families to do things together and leave screens aside, and also play in the public sphere. This is also one of our programs. And then finally, our proposal for an agreement for mental health at work. This is where there's been a lot of studies carried out how the work environment, workload, and the working hours and all the demands have an effect on our mental health and well-being. This is something that is increasingly on the agenda in many places, because since the pandemic, there's been a change in people's perspectives. Something that before was not labeled, now it's starting to be labeled. Even so, there's many of mental health issues have a high degree of stigma attached to them. I don't know if you can see this on the slide, but we say, well, you can often take off work because I have a fever, but it's hard to say I'm going to take off work before I had an anxiety attack. So, as you see, people usually hide these things, and this survey asked people about this. They said, have you ever left work due to a mental health issue? And says 50% of people had, but they hadn't confessed that was the reason. So that's something that we really have to take into account. At the City Hall, we had a whole series of actions that we carried out in order to foster health and mental health and well-being and our municipal workers. And we had this agreement, but we decided to go further afield than the workers at City Hall and try to ensure that these policies would reach others. And in that sense, we made an agreement with different organizations, labor organizations, employee organizations, trade unions, and so on. And we reached an agreement in order to prevent and foster mental health at work. After the signing of this agreement, which has 10 principles, for example, 6 says minimizing exposure to psychosocial risk factors at work. If there's a lot of stress, a lot of pressure at work, there's a lack of support, a lack of control over how much work is actually being done. All this has an impact on health, and these are aspects that have to be worked on. I'm not going to go into the details of all these different aspects, but also obviously improving working conditions is key. And it also has to do with working hours. And we've carried out different actions focusing on mental health. For instance, we have our health and work observatory. There was a specific monographic on mental health and work to see what impact it had on mental health, and another specific one on how the need for striking a work-life balance impacts mental health. So these are all different actions, as I said. One I wanted to highlight here is that soon we're going to have an online training session that will be published by Barcelona Activa, which is addressed to managers so that they know how to handle mental health issues in their teams. And we also want to disseminate all the resources that you may be working on that we can offer companies so that it will help them to improve their mental health. Time, of course, is a very important aspect here. And right now, we are starting to take this agreement to a series of companies, have a network of companies working for mental health at work. We may think that all companies that were part of this network will also be interested in having access to the offer that we have within the network. And there are also individuals that may be interested in improving the mental health situation at the organization, and therefore they can send an email to this email as you see here in blue, saludmentalfeina@bcn.cat, and you can access all this information, receive news and research about mental health at work, training sessions, best practices, and exchanges with others. So these are the examples that I wanted to show you today. I'll be delighted to ask any questions, and we hope to see you at our sessions.
Moltes gràcies.
Thank you very much. And now we will give the floor to Carme Esquirol. She's the Director of the Social Policies and Equality Services of the Àrea Metropolitana de Barcelona. So we thank her for being here.
Moltes gràcies a tots i especialment a...
Thank you very much, everyone, especially BTUI, for organizing such a comprehensive symposium. The aim of my presentation is to explain why Barcelona metropolitan area has time use policies and what they consist of, the main ones. You can't read the full title. The full title of this slide is why we are committed to time use policies. Well, there's no need to explain to you how important time use policies are for health. David has already done that. Mainly, the purpose of our commitment is to promote citizen well-being, to promote equal opportunities, because time poverty is something that particularly affects women. And we want to reduce this gap or get rid of it. Perhaps a more novel purpose from your perspective is, or a novel explanation from your perspective is why we want a metropolitan level time use policy. Nowadays, time use concerns go beyond strict municipal boundaries, and so we felt that metropolitan area level policy could be much more effective than an approach that might be strictly local or municipal. That way, we also contribute to reducing imbalances between towns, municipalities. First, I would like to highlight that our institution is clearly committed to time use policies. There is an item in the Metropolitan Action Plan that explicitly mentions the metropolitan area's commitment to develop the main, or to flesh out the main elements of the compact that we adopted. So we're committed to promote these items with some town councils. What this means is that we try to convey to all of our town councils how important it is to have a time use policy and how they can adhere to the compact and promote such policies. We also have a metropolitan social roundtable or board. And then we also have an approach of internationalization of time use policies set at a metropolitan level. So as I said, we have a metropolitan level action plan. All 12 of the municipalities of the 36 in the Barcelona metropolitan area have adhered to the compact. The compact was issued in 2022, so this is still ongoing. There are some towns that are considering how they might adhere to the compact and that have expressed the intention to adhere to it. Others are involved as well. Without a political commitment, it's very hard for time use policies to actually be implemented and deployed. The Metropolitan Social Board is a more technical sort of organization that we've set up, a way for the municipalities in the area to share knowledge and experience, to seek out experts, and to implement collaborative projects. We want the Metropolitan Social Board to be a space for learning, but also for collaboration. There are many institutions in the metropolitan area, and there's a certain tendency not to look beyond one's territorial scope. Since the social component of what our institution does is limited, we try to pursue synergies. Everyone who's involved in time use policies needs to secure better rights to time and deploy them. So we've done a good job, I believe, in promoting agreements among institutions. This board is also an opportunity for to collect information from the different metropolitan councils to convey their concerns to the government of Catalonia. The government of Catalonia is doing its own work, but it's good for it to be able to hear the metropolitan area councils. 26 of the metropolitan area, 36 municipalities have taken part in this board. Some smaller towns are finding it harder to join, but we expect all of them to engage sooner or later. Internationalization of time use policies with a metropolitan outlook. From the very start, we wanted to learn what other metropolitan areas were doing. Could I have some water, please? I have a bad cold, I'm sorry, and my throat is drying out. We wanted to learn from the outset from other metropolitan areas. Together with BTUI, I hadn't seen the water. So together with BTUI, we're seeking out good practices or best practice that can be promoted from the perspective of the Barcelona metropolitan area. And we're also involved in a network of local and regional authorities, and we're also part of the Time for All and Time for All 2 European projects. Here are some of the authorities we have contacted. Some of them are here today and will be sharing their own experiences. In our present mandate, we have chosen to focus in reaching out to municipalities to address the productive fabric, the employment aspect, because employment and work is one of the main friction factors leading to a loss of well-being. And so we have focused on this particular sphere. Pedro Martin is the expert in charge of time use policies in the metropolitan area, and he will have his own session to describe what we're doing in detail. But anyway, we have my presentation is meant to give the general framework of what we do. In any case, what we do is provide economic support for local councils. So we have subsidies that town councils can use in order to implement time use policies. 30 million over 4 years. The city of Barcelona is excluded from such subsidies because of its size. And all of us, but particularly Pedro, are trying to spearhead the creation of such projects. In addition to that, we have an advisory and support program for town councils so that they, in turn, can help promote good time use policies in employment. Support is different from guidance because it lasts over time. when we provide guidance or advice, it's just initial advice to start to implement something. What we call support, accompaniment, is something that extends over time. So here we have the town councils that joined. We're currently supporting the Town Council of Esplugues de Llobregat. Their program is already quite mature, but we're providing ongoing support. So accompagnement, we're going to translate as ongoing support. And so what they have in Esplugues is a network of firms, a network of companies where they want to that want to promote good time use policies. We're also working to support Sant Boi de Llobregat, which is kicking off a project called Conciliació, and we're working together with Sant Adrià del Besòs and Barberà del Vallès, where we're only beginning to provide our advice, our consultancy, if you like. We're also helping town councils diagnose their implementation of time use policies. In 2022, we started sending out surveys to town councils to find out what kind of time use policies they were implementing. It's been 2 years. It's also been 2 years since some of them joined the municipal compact. And so we're redoing the survey to find out what has actually been done, so that in 2025 we can see where we should target our support. In the sphere of support for companies, we have produced a guideline that is, on the one hand, a list of good practices, and on the other hand, 10 rules for a rational and balanced organization of work time. This is for the benefit of any kind of company. This is not a printed guide, but there's a leaflet. You can collect it outside. That includes the URL, where you can download the full guide. Pedro will be telling you more about this guide. Yes, tomorrow afternoon. I believe it's in the afternoon. So if you have any questions, I'm happy to answer them, and so is Pedro. Thank you very much. Well, Ms. Esquirol just said it. If you have any questions for Mr. Malmuzio or Ms. Esquirol, speak now or forever hold thy peace. So, do you have any questions from the floor for either of them? No, then it was perfectly clear. Oh, there is a question. Can we have a mic? Can you tell us who the question is for? Ms. Esquirol? Okay, just a minute. We'll give you a hand mic. That way everyone can hear you and everything will be easier. Plus, the interpreters can only interpret what is spoken into a microphone. We heard that you are also advising and providing ongoing support to town councils, but I work in a county council. Are you providing support at that level as well? We're not advising county councils, or that's the idea currently. But we want to promote time use policies. You are a supra-local body, so you're also working with town councils. So let's talk about this. Let's discuss it, see how to approach things and how we can meet and work together. Thank you very much. Any further questions from the floor? We'd like to remind you that all of these sessions are being streamed, so we would like to welcome and greet those of you who are following us online. Without further ado, we will go on to the next session. We have a 15-minute break. At 10:30, we will begin the second meeting of the Catalan Network for the Right to Time. See you shortly.